Hello and welcome to the nurses section of your orthopaedic pre-assessment education video. My name is Kathy. I'm one of the CNM2s here in our orthopaedic pre-assessment unit on our orthopaedic team in St Vincent's Private Hospital. Over the next few minutes, I will go through some of the main points to help you prepare for your joint replacement surgery. We will cover preparing for your admission, what will happen during your hospital stay, and what will happen after discharge. This will help to supplement information provided to you by your consultant, pre-assessment nurse, physio, and what's provided in your joint replacement booklet. Preparing for your surgery. Once you have decided with your consultant that you're for joint replacement surgery, you'll be referred for a pre-op assessment appointment approximately 1 month before your surgery date. The consultant secretary will provide you with an information pack which will include a pre-op questionnaire and a medication list. It is important to take some time to complete these prior to your appointment so that you can give the nurse as much information as you can on the day. You can ask your GP or your pharmacist to assist you with this. If you attend a medical specialist or cardiologist, it may also be helpful to get some notes on your condition from them. The consultant's office will give you the insurance codes you need so that you can check your cover with your insurance provider prior to being admitted to the hospital. The consultant's office will also provide you with a list of convalescence centres to attend should you feel you need to avail of that post-op. If so, it is important to book this well in advance as spaces may be limited. You should confirm your place and date of arrival with the convalescence centre prior to your admission. You should also arrange your own transport to the convalescence centre. Some insurance companies now also provide home physio service, and again you should check your entitlements with the insurance company prior to your admission. Your consultant may also ask you to have a check-up with your dentist and to provide them with a dental clear insert within 3 months of your surgery date. This is to reduce the risk of having a potential oral or dental infection which could travel to your new joint, causing significant problems post-op. Remember, it may be difficult to sit in a dental chair for a couple of weeks post-op, so better to address any potential problems pre-op. You should bring this cert or letter with you to your pre-op appointment. Your pre-op assessment will take approximately 2 to 3 hours. You should wear comfortable clothes, have your breakfast, and take all your meds before attending. On the day of your pre-op assessment, you will meet a nurse, a physio, and a healthcare assistant. They will take a detailed medical assessment. You will have a blood test, an X-ray and an ECG, which is a tracing of your heart. You will have your weight and height and blood pressure recorded. You'll be asked for a urine sample and have some routine hospital swabs taken. Occasionally, you may need additional tests depending on your medical history or if abnormal results are detected. If this is required, the pre-op team will arrange this with the anaesthetist or other medical specialist. Your surgery may need to be delayed until such time as these issues are resolved or you're past fit for your surgery. You may also be required to stop some of your medications in the run-up to your surgery. If this is the case, the pre-op assessment nurse will advise you accordingly. It is important to be as fit as possible in the lead up to your surgery as it will make your recovery much faster. We would encourage you to continue with some exercise and to eat a healthy, balanced diet, as this will help in the healing process. If you are a smoker, we advise you to give up smoking or at least reduce the amount you smoke per day. Smoking interferes with wound and joint healing and can even impair bone growth. If you do smoke, please inform your pre-op nurse and admitting nurse, as they can provide a nicotine patch if you so wish. If you develop any signs and symptoms of an infection, such as COVID, dental, urinary or chest infections, you will need to let your surgeon know. You should also advise your surgeon if you develop a flare-up of your eczema or psoriasis, develop a rash, an ulcer or a skin sore around your joint area. You should pack your bag for hospital a few days in advance. It is important that you bring your medications with you so that they can be checked by a pharmacist on admission. We advise patients to get dressed into comfortable clothes the day following surgery, so tracksuit bottoms, shorts or loose-fitting clothes are appropriate. Having comfortable footwear such as runners is essential. We do not recommend slippers. You are also advised to bring your glasses, contact lenses, hearing aids and walking aids. If you use sleep apnea machine or any other medical equipment, please bring those also. You should leave any valuables that you do not need at home. You will be required to take off all jewellery prior to surgery. You should prepare your home surroundings by removing or taking away any rugs, mats, cables or wires. These may act as a trip hazard. You should organise your furniture so that you have a clear path to your bedroom, bathroom and sitting room. You should also organise your everyday items such as kitchen utensils and toiletries so that they are within easy reach. All of this will help you feel safe and ready for your surgery. Day of surgery. Unless requested by your consultant, the vast majority of patients will be admitted to theatre on the morning of surgery. At the pre-assessment clinic, you will be given a pack containing some antibacterial soap, which you will need to shower in the night before and the morning of your surgery. You will also get some antibacterial wipes. You can use this antibacterial soap as you would use normal shower gel. You do not need to wash your hair in this. You should try out this soap a few days in advance and monitor for any reactions. If any reactions occur, do not use and just shower in your normal soap and water. After your morning shower, you should dry off with a clean towel and use your antibacterial skin wipes. The pack will contain 2 wipes, one to use on the entire limb, the other to concentrate on the joint. You should avoid shaving other than facial shaving for 2 days prior to the surgery. You should also avoid using any creams, lotions or cosmetics on the leg to be operated on. You should remove any nail varnish or false nails. This is all in an effort to avoid any infections post-op. On the day of your surgery, as a rule, you should fast from 6 hours from food and 2 hours from clear water prior to your surgery. If your surgery is in the morning, you will be fasting from midnight. If your surgery is in the afternoon, you may be allowed a light breakfast. This will be clarified by your pre-op nurse. Once you are admitted to the ward, you will meet the nursing team who will confirm all your details and prepare you for the operating room. We may need to repeat some bloods or some tests, and these will be explained to you. You will be changed into an operating gown and a hospital stocking will be put on your non-operative leg. You will meet your consultant who will do your consent form and put a mark on your leg. Most people can walk to theatre, some people need to go to theatre on a bed. Once in the operating theatre, you will meet a nurse at the barrier who will once again confirm all your details. You will also meet an anaesthetist. Joint replacement surgery is usually carried out under spinal anaesthetic with sedation. However, you will discuss this with your anaesthetist and the risks and benefits associated with all the different options. When you wake up from surgery, you will be in the recovery room. You will have oxygen in your nose, a drip in your hand, and a monitor on your chest and on your arm. You will have hospital stockings on your legs, foot pumps on your feet. All of this is to encourage circulation, and all of this is routine. When the time is right, you'll be returned to the ward. You'll be given some water to drink, later a light meal. When the nurses are happy, your monitors and drips will be removed. You will be reviewed by a physio and some gentle bed and breathing exercises will begin. If appropriate, you will sit out of bed and mobilise with the frame. Early mobilisation is a key part of your recovery. In the first few days, it is important to always have a member of the hospital staff with you when you're mobilising, as you may become dizzy or lightheaded when you sit out of bed. You will have a call bell in reach at all times. Remember, call, don't fall. After surgery, you will be on additional medication for a few days. Some of these are antibiotics to prevent infection. Some of these are medications to prevent clots. Good pain management is important throughout your hospital stay so that you can fully engage and participate in your physio programme. Your consultant and anaesthetist will have you on a protocol of regular painkillers. You'll be asked to rate your pain on a scale of 0 to 10. 0 meaning no pain, 10 meaning extremely bad pain. The nurse will endeavour to keep you as comfortable as possible. The nurse will adjust your medication accordingly. They may also use ice, which will help to provide comfort and prevent swelling. Day 1 of recovery. The morning after surgery, you'll be assisted to sit at the sink so that you can wash and change into your clothes. You'll be encouraged to sit out of bed for all your meals and to engage with the physio in your exercise programme. You may have an X-ray and a blood test depending on your consultant's protocol. Day 2 of recovery. Today you can have a shower with the assistance of the nurses or the carers. You can dress into your day clothes and sit out for all your meals. Today you will continue your rehab programme with the physios, which will include some walking practice with the team on the corridor. You will also aim to do the stairs. The vast majority of patients will be ready for discharge by day 3. On the day of discharge. On discharge, you will be given a prescription for some painkillers and for some anti-clotting medication. You may also be prone to constipation after your surgery. It is therefore important to drink lots of fluids, both while you're in hospital and at home. Some patients will require laxatives to manage this, and this will be included on your discharge prescription. Your wound will be reviewed every day on the ward, and your dressing will be changed prior to discharge. Your dressing will be waterproof, so it is okay to shower as normal. Some patients may have sutures that dissolve themselves, others will have clips. These can be removed on day 14. This can be done by your GP, practice nurse, or you can return here to the hospital dressing clinic. Your nurse will give you your individual instructions for care of your wound. It is normal to have some bruising, discoloration or swelling on your operated leg, which may track downwards. This should fade over time. Should you have any concerns about your wound at home, it becomes red, hot, swollen, develops an ooze or an odour, please contact the ward or the GP for review. Most patients will be allowed to remove their anti-clotting stockings and foot pumps on discharge. At home, you should continue to be vigilant for signs of a clot or deep vein thrombosis. While the rates of these are low and you will be on medication to prevent these, they can still occur. The best prevention is early mobilisation and staying active. If you feel you are developing any swelling, cramp-like feeling or discoloration of your calf, feel your heart racing or pain in your chest, please contact the ward for review. Driving is generally not permitted until your consultant has cleared you to. This is usually at 6 weeks. We also advise that you check with your insurance company re their cover, as they might have some extra requirements. Finally, I encourage you to read through your joint replacement booklet. All the information you need for before your surgery is in it, including exercises to begin, frequently asked questions, and a reminder of what to pack for your stay. It may also be helpful to share this video with your next of kin or family members so that they can support you throughout your hospital journey. If you have any further questions prior to your surgery, please contact the consultant's office or the orthopaedic team on the numbers provided in your booklet. Finally, good luck, and we look forward to seeing you here for your surgery at St. Vincent's Private Hospital.
Hi, my name is Tom. I'm a senior orthopaedic physiotherapist at St. Vincent's Private Hospital. The purpose of this video is to provide you with all the information you need to prepare you for your upcoming surgery. This information is also included in your joint replacement booklet, which you hopefully have received by this point. Here at St. Vincent's Private, we run an enhanced post-op recovery program. As part of this, we aim to see you on the day of your surgery once you are back on the ward. To be eligible for this, you will need to be back on the ward in good time. You will need full sensation back in your lower limbs and be medically stable. We will aim to commence exercises and stand you out of bed to take some steps on the day of your surgery. If you are not seen the day of your surgery, don't worry, we will be in to see you the following morning. Once you've been taught your exercises by your physiotherapist, we strongly recommend completing them 3 times per day to ensure you have the best outcome post-surgery. We will continue to practice your walking with you until we advise that you are safe to walk by yourself with crutches. We will also practice the stairs with you if required prior to going home. In your booklet there is a set of exercises. It is recommended that you commence these exercises now if you can do them without pain. These will help to maintain and optimise your mobility and strength prior to surgery, and to regain movement and control around your new joint after surgery. We recommend you dress daily in your normal clothes. This should be loose, comfortable clothing such as long tracksuit bottoms or shorts, or nightwear. You'll be doing your exercises and walking practice daily. Correct footwear is very important. We recommend shoes that have a low flat heel and they must have a closed back. It is easier to have shoes that can slip into rather than shoes with laces, or you can replace your laces with elastic laces. As you may have temporary swelling in your legs and feet after surgery, we recommend that you don't bring shoes that are tight-fitting, as it may be difficult for you to put tight shoes on. There is a section on general safety advice for your home in your booklet. This gives advice on how to make sure your home is ready and safe for your return. If you live on your own, you may consider arranging for someone to help you at home, or you may consider organising respite and convalescence. It is your responsibility to arrange convalescence if you decide this is best for you. The use of ice for controlling pain and swelling after your surgery is very important. We provide ice on the wards for you to use regularly and recommend you continue its use at home. We recommend you see a chartered physiotherapist in an outpatient setting, 3 weeks after a hip replacement or 2 weeks after a knee replacement. You have some options for this. We run a physiotherapy-led hip and knee class for patients post-surgery within Vincent's Private. We can book you into a class prior to discharge. Some patients may require one-to-one follow-up, and we can facilitate this in St. Vincent's Private Hospital as required. We can also provide you with a referral letter if you wish to attend a physiotherapist local to you. On discharge, we will arrange any bookings for appointments back in St. Vincent's Private, or we will provide you with a referral letter. Please consider these options prior to surgery, and we will speak to you about it during your stay. There is a small risk of dislocation after total hip replacement surgery. To avoid this, you must follow hip precautions after surgery until you have your follow-up review with your consultant. This will be approximately 6 weeks after surgery. These precautions are found in your booklet. Please make sure you read these thoroughly. There is also a list of equipment in your booklet that we recommend you purchase prior to surgery to allow you to follow the hip precautions. This equipment includes a raised toilet seat, a long handle shoehorn, a long handle grabber and a sock aid. This equipment can be purchased from most medical suppliers. We also recommend that you consider which chair will be most appropriate to use when you go home. The chair must have an appropriate height to keep your hips above your knees, have a firm seat and armrests. I hope you have found this video helpful, and please remember to study your joint replacement booklet thoroughly. We look forward to welcoming you here to St Vincent's Private Hospital. This morning I'm going to be showing you some of the exercises that you can make a start with before your surgery and that you'll be doing after your surgery. When performing the exercises, make sure that you don't do them on the floor, that you do them on a bed or a sofa that has plenty of space for you to perform the exercises. The first exercise is an ankle pump exercise. So with the legs out in front of you, you're going to point the toes down and then back up towards you, and you can repeat that 15 times. This is a circulation exercise, trying to prevent blood clots and DVTs, so it's something you can do regularly throughout the day. So the next exercise is a quadricep contraction. You're going to push the back of the knee down against the bed, tensing your thigh for 5 seconds, and you repeat that 15 times. The next exercise is a gluteal contraction. You're going to be squeezing the buttock muscle for 5 seconds and then repeating that 15 times. You should feel yourself lift slightly as you do this. For the next exercise, you may need a foam roller. If you don't have a foam roller, that's okay. You can use a pillow and fold it in half to be used as a foam roller. It's called an inner range quad exercise. You rest underneath the operated knee, and then you're going to tense the quad muscle, keeping the back of the knee against the foam roller, and you're going to be lifting the foot out in front of you. And again, you hold that for 5 seconds and repeat that 15 times. So you push the back of the knee down against the roller, lifting the foot off the bed, hold for 5 seconds, repeat that 15 times. On the ward, we'll be using one of the blue boards. If you don't have a blue board like this at home, you can use plastic bags just to take away a bit of friction for the exercise. You're going to place this underneath the operated leg, and then you're going to slide the heel up towards you, keeping in mind that you still have to follow the hip precautions for this exercise, so the knee can't come up above the hip. And you're going to repeat that 15 times, going up and down like that. For the next exercise, it's moving the foot out to the side. So you may need to replace the board, or we'll do that for you when you're in the hospital. You're going to be bringing the leg out to the side as far as you can, and then come back in. It's important that you keep your foot rested against the board so you don't lift the foot up. For the next exercise, we'll be focusing on range of movement of the new hip joint. To start off with, we'll just be bringing the foot out in front of you. So with the operated leg, you're going to be just bending the knee up towards you, like so. Making sure that, again, you don't let the knee come above your hip to follow the hip precautions. Repeat this 15 times. And the next exercise is bringing the operated leg out to the side. So holding on to something sturdy again, you're going to bring the leg out to the side like that, making sure that you don't sway or rock from your upper body, and you repeat that 15 times. For the next exercise, we're focusing on hip extension. So keeping the knee straight, you're going to bring the leg behind you like this. Just make sure that you don't kind of rock forward with your upper body, so everything else stays still. The movement is just coming from your hip, and you're going to repeat that 15 times. Thank you for watching this video. Remember, you can rewatch this video to guide you through your exercises until you feel comfortable with them. I look forward to working with you through this recovery. From all of us at St Vincent's Private Hospital, we wish you the best of luck with your joint replacement surgery.